Once again, you're listening to Eye on the Community, and I'm your host, Sean Anthony. Excited for my next guest. Coming back to the program, the executive director of the Ohio Sickle Cell and Health Association, Miss Annie Ross-Womack. Welcome back to the program. How are you, Annie?
I'm fine. Thank you for having us back all the time.
My pleasure. It's always a pleasure to have you. Now, this month is Sickle Cell Awareness Month. Now, we need to let Central Ohioans know about Ohio Sickle and Health Association and how you work with people with sickle cell disease in the community. Let everybody know, please.
Well, Sean, we've been here since 1960. The organization has been. I haven't, because if I've been here that long, I look very good for my age. But we've been here since the 60s doing education, outreach, and advocacy in the community around sickle cell disease and sickle cell trait, and then any other hemoglobin blood disorder or just hemoglobinopathies are what they call, but any abnormalities in blood disorders across the state. So we've been here doing education. We've been here doing family support and outreach services again since the 60s.
Now, I know that you guys have a lot of events planned all throughout the year, but in particular, this month, September, is Sickle Cell Awareness Month. What events do you have planned for the rest of the month?
We have a lot of blood drives, a lot of blood drives. And if we don't have a blood drive in your area, start one. Please help us donate blood. We just completed Sickle Cell Sabbath, and what that was the 17th and 18th. We had several blood drives across the state. We have a blood drive coming up every Sunday. The rest of this month, we have one out in Mount Olivet. We got blood drives, just blood drives. We had one over at First Church. So sign up for a blood drive in your area because blood is very important. At the beginning of the month, we had balls, we had outreach. Actually, on tonight, well, this won't be tonight, but we're having different events all throughout the city. We're having the lighting of the city hall. We're having blood drives. We're having outreach activities and events. We're having a lot of information. You can get that off our internet, off our Facebook pages, where we're going to be. So we're in and out the community all month.
Excellent. Now, I understand that there are new FDA approved medications for sickle cell disease. What are they and how do they help? And also tell us about any advances in helping people with sickle cell disease and or the trait.
Well, I mean, since we talked about this last year,
Right.
we have the same three FDA approved medications. We haven't had any new ones in 2022. We
Okay.
had a couple in 2019 and one pre-COVID, and they're all different. One medication is given at the hospital when a person is in sickle cell crisis. It helps lessen that crisis or lessen that pain. The other two are medications that they can take on a daily basis to kind of ward off a sickle cell crisis or a pain episode. So two again are over the counter. They're mixes that you drink every day. One's a pill, one's a powder, and then the other one is something that's a shot that they give through the IV at the hospital. As far as advances, again, there haven't been any new advances this past year since we talked last year. But there is CRISPR technology, and that's going toward gene augmentation therapy, which is something futuristic, right?
Right.
So
You see my
that's
eye,
something.
you see my eyes perked
Yeah,
up.
it's like, oh yeah, but that's something that's kind of far off and it's very expensive and it's still in its phase 2 stage of trying to make sure that it actually works. And so we had clinical trials, FDA approved the first trial based on some of the outcomes, and now they're in phase 2 to continue the survey because it's a very, very, very stringent criteria to get in to do that type of procedure, and it's very costly. So you want to make sure that it works before somebody enrolls in it.
That's interesting, Annie. I'm genuinely interested in the follow-up on that because I've done some research on CRISPR technology and done previous broadcasts on that subject. So I'm really interested to see how that turns out. Switching gears here, talk to us about the Get Connected registry. Why is it so important for people to sign up?
Well, the Get Connected registry is sort of like a LinkedIn or Facebook, if you will, just for sickle cell people with sickle cell and their families. That's a nationwide registry or and/or database, but also included inside of that database are also physicians uh, who are very knowledgeable about sickle cell, hematologists and specialists, as well as pharmacies, and then you get links to those various clinical trials like we were talking about with CRISPR technology and any other updates on medications. So when they first come out, then our patient population, our client population, or families living with sickle cell disease are eligible, or they're kept up to date with what's happening in their own world, so that they don't have to hear about it secondhand, and so they can enroll themselves or request advanced information prior to something hitting the public airway.
Now, is there anything new happening on a national and state level with
Well,
your
on a national level, next month in October, we'll be having our national convention. Actually, SCDA, our national office, turns 50 years old. So we've been having education advocacy on a national level, and they are, pursuing different, legal acts, Sickle Cell Demonstration Treatment Project Act, trying to go back on the hill and get funding for the adult population, because we have funding for the children's population, but we don't have those same type of services for adults, because people with sickle cell are living longer, but the life expectancy used to be under 12, then it moved to 20, and it has gone fast. We just lost someone in our population, our family, that turned 60. So people are living longer, but they still don't have those comprehensive services, and there's no funding. So that's what we're doing on both the state and on a national level. And then on the state level, OSHA, which is us, Ohio Sickle Cell and Health Association, we're fighting to get that trait registry because of the NCAA's new ruling for all division athletes to have a negative sickle cell solubility test upon entering any sport. So every child, no matter what race, what nationality, they have to have a negative trait status documentation before they play sports.
Things have opened up, obviously, due to COVID-19. And, I know that you guys made some adjustments as far as how you guys operate with patients, but how people are still getting sick out there.
Oh,
And
definitely.
the cases have not, dwindled
They
down to
have not.
zero, but how is COVID-19 affecting sickle cell patients?
Well, I mean, COVID-19 is going to be here because people have this misunderstanding of what a virus is. They
Right.
really don't understand. You can have an outbreak and a virus, but the virus has already been here. COVID, the COVID virus has been in the land for many years. This is nothing new, but the outbreak happened when so many people got affected at the same time. So, for our population, we're used to stay at home, secure hand sanitizer. So this is nothing new for us. Mask wearing, gloves, hand sanitation. This is something that anybody with any type of genetic disorder has been doing all their lives, because a common cold could make them sick, or they can do things. So we have a lot of rare disorders out there, and people didn't really understand the precautions that people had to take when they had rare diseases. But now, since COVID has kind of ravaged the land and everybody had to take those precautions, that's what families have been going through for decades. So
Wow.
now it kinds of lends empathy to the situation. They're not sympathetic, like, oh, those poor kids. Now they really understand that when I tell you that I can't have my children around your children, not because they're allergic to peanuts, because they could die if you cough on them and they get sick and they get pneumonia because they have no immune system. Now people are starting to understand these childhood, abnormalities better. So I think what COVID did was it just heightened the awareness of just not just sickle cell, but any other genetic disorder, to where people are now trying to understand why, people have taken these stringent precautions, because they thought we were weirdos, but now they realize, whoa, sanitation is a good thing.
Right.
Wash
Right.
your hands is a good thing. Let me just try that. So,
Right. So before we conclude, the Ohio Sickle and Health Association is a statewide agency. Where can people get more information about sickle cell trait and disease?
well, I always try to educate people anytime I speak to anyone to go to credible sources. So, Ohio Sickle Cell and Health Association, we're on Facebook, we're on Twitter, ohiosicklecell.org. You can call our offices at 614-228-0157, or you can go to the CDC's website, the Center for Disease Control. They have a warehouse of sickle cell information. or any of the national database, like the federal government, and look up sickle cell, because those are credible sources. And then we have a lot of support groups out there in your area. Google them, see what they're doing. So everybody has sickle cell information, but if you want facts and data, you would either go come to us or our parent company, Sickle Cell Disease Association of America, CDC, NIH, organizations like that.
Miss Annie Ross-Womack, the executive director for the Ohio Sickle Cell and Health Association. It is always a pleasure to speak with you, ma'am.
It is always a pleasure speaking with you. And if you want to talk to me more about that gene therapy, I'm really willing to go.
Okay, sounds good. Well, you take care. Talk to you soon.
Thank you so much, Sean.
Bye now.
Bye bye.